Welcome back to MedMadness, the podcast where we break down complex medical topics into easy-to-understand discussions. In today's episode, we're diving into a critical and often misunderstood syndrome called catatonia. While it's not a specific disorder, catatonia can occur in a variety of severe psychiatric and medical conditions, particularly in those with mood disorders, psychotic disorders, or even certain medical illnesses. Understanding catatonia is essential for timely diagnosis and treatment, which can be life-saving. Next, let's discuss the key features of catatonia, how it presents in patients, and the main treatment options available. By the end of this episode, you'll have a clear grasp of this syndrome and be better equipped to recognize and manage it. Catatonia is a psychomotor syndrome, meaning it involves significant disturbances in movement and behavior. It can manifest in several ways, ranging from complete immobility to excessive, purposeless activity. The most striking features include immobility, mutism, and what we call waxy flexibility, where a patient's limbs remain in a position they're placed in, almost like a wax figure. Patients with catatonia may also exhibit behaviors like posturing, where they hold bizarre or unusual positions, and echolalia or echopraxia, where they mimic words or movements they see or hear. Next, let's explore the associations of catatonia with severe psychiatric conditions such as bipolar disorder with psychotic features, schizophrenia, and even severe depression. However, it can also occur in patients with autism spectrum disorder or as a result of medical conditions like infections, metabolic imbalances, or neurologic and rheumatologic diseases. Now, let me share a brief case study to illustrate catatonia in a clinical setting. A 32-year-old male with a history of severe bipolar disorder was brought to the emergency department by his family. For the past 3 days, he had become increasingly withdrawn, eventually becoming completely immobile and unresponsive. During the examination, the patient did not speak or move, even when asked direct questions. His limbs remained in whatever position they were placed, showing the classic sign of waxy flexibility. The clinical team suspected catatonia and administered a lorazepam challenge, an intravenous dose of lorazepam, which is often used to confirm the diagnosis. Within minutes, the patient showed partial improvement, briefly responding to questions and moving his limbs voluntarily. This rapid response confirmed the diagnosis of catatonia. Over the next week, with continued treatment using lorazepam, the patient gradually returned to his baseline functioning. In summary, catatonia is a complex and serious syndrome that requires prompt recognition and treatment. The key features to watch for include immobility, mutism, and posturing, among others. Treatment typically involves benzodiazepines like lorazepam, and in cases where there is no response, electroconvulsive therapy, ECT, can be life-saving. We encourage you to deepen your understanding of catatonia by engaging with our pre- and post-podcast quizzes and Anki flashcards. These tools will reinforce your learning and help you retain key information for future clinical practice. Thank you for listening to MedMadness. Stay tuned for more insightful episodes, and remember, understanding is the first step toward making a difference in patient care.